Welcome back, Raven.
Welcome back, Raven. You have been selected because you have demonstrated superior critical reasoning skills. And critical thinking is disciplined reasoning whereby individuals formulate ideas about what to believe and, most important, what to do. Particularly in crisis situations where time is short, emotions are running rampant, and calm, cool and collected leadership is imperative to deliver decisive action. Critical thinking involves determining the meaning and significance of what is observed or expressed. It also involves determining whether adequate justification exists to accept conclusions as true, based on a given inference or argument. Critical thinking is essential to understanding situations, identifying problems, finding causes, arriving at justifiable conclusions, and making quality plans. It is essential to improved analysis. Do you have what it takes to be ready to fight tonight, on a moment's notice? Do we have your attention? We know that you're interested. Have you made your decision for crisis management? Lights. Camera. Action. In this role-play simulation, you shall be presented with current situations being reported in the news and by various government officials. You shall be required to apply your critical reasoning skills to develop actionable intelligence. Do you want to play a game? As you are aware, Raven, simply having information is unproductive, irrelevant and ineffective. Moreover, the effectiveness of the intelligence war-fighting function is measured against the relevant information quality criteria: accuracy, timeliness, usability, completeness, precision, and reliability. Effective intelligence meets 3 additional criteria: relevant, predictive, and tailored. According to Army Field Manual 2-0, actionable intelligence is an example of bringing the characteristics of effective intelligence together with the effective integration of intelligence into ongoing operations to support the commander, and Army personnel have used the concept of actionable intelligence to reflect the joint concept of critical intelligence. In current operations, the concept of actionable intelligence is used by Army personnel to describe information that answers operational requirements. Army personnel also use it to describe specific commanders' guidance in the attack guidance matrix to a sufficient degree and with sufficient reliability to support the commander's targeting decisions. Intelligence drives the mission cycle, and, ideally, the staff thoroughly integrates intelligence into the operations process to ensure the collection and reporting of timely, relevant, accurate, predictive, and tailored information and intelligence. If you have been following current events, you, no doubt, are aware that a new variant EG.5, dubbed Eris, is now the dominant strain globally, with there being a noticeable spike in infections over the past 4 weeks, says the World Health Organization. About 20.6% of new COVID-19 cases are thought to be caused by EG.5, according to data from the Centers for Disease Control and Prevention, CDC, a significant jump from 7.5% during the first week of July. And in more recent news, health authorities and scientists say they are now racing to study BA.2.86, a new strain of the virus that causes COVID-19, after the highly mutated variant was spotted spreading in multiple countries around the world and at least 4 different US states. And a number of questions remain about the variant, nicknamed Pirola on social media, whose mutations could amount to an evolutionary jump on par with the emergence of the Omicron variant in 2021. However, Despite the widespread news coverage, to date, only 24 confirmed infections have been reported to the global virus database GISED or announced by health authorities, and no deaths have been reported, according to the 24th of August WHO report, a similar fact pattern from the beginning of the public health outbreak in China, where a total of only 27 cases in a city of over 11 million, with no fatalities and, at that time, no evidence that the disease was being transmitted from person to person. Beijing health authorities had placed the WHO on a global alert. The first reported US case was reported from a sample collected on August 3, according to metadata reported to GISED by a lab at the University of Michigan. A second US case of BA.2.86 was reported to GISED from a sample collected on the 10th of August at Dulles International Airport in Virginia. The third US case of BA.2.86 has been confirmed in Ohio, a spokesperson for the state's health department told CBS News. New York became the fourth to report the variant, after spotting BA.2.86's distinctive mutations in New York City's waste uter. Ohio had previously confirmed it was also investigating with the CDC a preliminary detection of BA.2.86's distinctive mutations in its sewers. No other states have reported BA.2.86 in their waste uter so far, a CDC spokesperson said the 30th of August. First, determine from this information what would be described as satisfying the criteria of accuracy, timeliness, usability, completeness, precision, and reliability. Most importantly, for an intelligence analyst, what from this information is relevant, predictive, and tailored for operational use in a reasonably calculated plan to alter outcomes with effective results. If COVID-19 is an infectious disease, especially of a highly contagious variety, most would expect persons to come into contact with the virus, and become infected with the predictable associated outcomes. However, in quantifiable terms, can you provide any information regarding the secondary attack rate of these new variants? Is there an objective metric to utilize to compare either Pirola or Eris to previous variants? As you are aware, when the Journal of the American Medical Association had examined household trace contact studies on the original strain of the Omicron variant, they had determined that the most transmissible variant yet for COVID-19 had only a 42.1% secondary attack rate, or giving a person a better chance of winning a coin toss than being infected by their own roommate. Most significantly, falling below the threshold of 60%, not even the Omicron variant had satisfied the clinical definition of a highly contagious disease that might be capable of setting off a super spreader event. And this variant had not been presented in this manner to the general public, providing a clear and refined picture of the actual threat becomes concerning, particularly as now increasingly alarm is being stirred regarding new variants. Do you have any further questions? Did you notice anything additional that had appeared unusual or out of the ordinary? Please take a note of your initial impressions. This concludes this leadership assessment simulation, and you shall be contacted with the results. Thanks for your participation. That is all. Carry on.
This message was approved by Major Mike Webb. Honest.